So I will be going through a little bit of a 101 on what is PrEP, and how effective is it, what is it for, who is it for, why is it important, what are the concerns that you might have about PrEP, and how can it be delivered. So starting with what is PrEP. PrEP stands for pre-exposure prophylaxis, and it's an HIV prevention strategy in which people without HIV take an oral retroviral drug before exposure to HIV to reduce their risk of infection. Some people think of PrEP a little bit like the female contraceptive pill, but it protects against HIV rather than pregnancy. It's safe and it's effective, and it's very easy to prescribe for the majority of patients. WHO recommends the drug used contains tenofovir, and usually countries use tenofovir with emtricitabine or tenofovir with lamivudine. WHO currently recommends that PrEP is taken daily, although other regimes do exist, including event-driven PrEP. Next slide. Can I do it? No. Okay. So I was asked also to address PEP very briefly. And my key message here is that PrEP is not PEP, despite the fact that they sound very, very similar. PEP is post-exposure prophylaxis. I'm sorry, there is a typo on my slide. And it's a prevention strategy in which people take antiretroviral drugs after exposure to HIV to reduce their risk. It must be commenced within 72 hours and taken for 28 days post-exposure. PEP for people with occupational and non-occupational exposures is an important additional tool that many countries don't really list within their comprehensive package of HIV services. As I mentioned, oral PrEP containing tenofovir is recommended by the WHO, and it's recommended to be offered as an additional HIV prevention choice for people at substantial risk. It's a strong recommendation based on high quality evidence. And the reason that it's based on this evidence is PrEP is effective when it's taken. So there's very high evidence that PrEP efficacy is highly correlated with PrEP adherence, and that WHO, WHO, US CDC, and others recognize that PrEP has over 90% efficacy based on per protocol analyses, and recent studies like Epic New South Wales have shown efficacy as high as 99% when taken daily. It is highly effective. So who is PrEP for? Based on the evidence from clinical trials and other studies, in 2015, WHO recommended oral PrEP as an additional prevention choice for any person at substantial risk of HIV, as part of a comprehensive prevention program, which includes HIV testing, links to treatment, which we know is highly effective in preventing onward transmission, condoms, harm reduction interventions, and etc. It's really critical to note that this recommendation is not population specific. It's really about being at substantial risk for HIV infection. Populations at risk for substantial HIV infection are provisionally defined as an incidence of 3% or greater. And basically, people in key populations are the most likely to benefit from PrEP. But PrEP is not appropriate for everyone. So PrEP eligibility, WHO has helped define the people most likely to be at substantial risk of infection. Of course, to be taking PrEP, you need to be HIV negative. But other criteria include, and sorry, this is a bit difficult to see on the slide, but having a sexual partner, being in a serodiscordant relationship with a partner who is not virally suppressed, or being sexually active in a high HIV incidence or prevalence population, and having vaginal or anal sex without condoms with more than one partner, or a sexual partner with more than one risk factor, a history of an STI, use of post-exposure prophylaxis, or requesting PrEP. And requesting PrEP was recommended by WHO for a very important reason, and that's that it can be very difficult to disclose your HIV risk factors that might make you eligible for PrEP. And so for that reason, it's really important that people who ask for PrEP, that it is offered from the WHO point of view. Contraindications, of course, you can't be HIV positive. PrEP is not treatment, even though they use the same drug. Things like renal function, not having an acute infection, and not being allergic to the medications. But why do we need PrEP in Indonesia? The simple message to that is, as we've already heard, PrEP is an additional prevention tool, and there's already a massive prevention gap. Condom promotion alone is simply not working. And that's not unique to Indonesia. That's in many places in the world. So we need to do something more, and we know that PrEP is really highly effective. We also know that the vast majority of people don't know their status. About a third are on treatment. We need to do more overall. There are too many people at risk for HIV. And I will skip most of this, but just to say that HIV prevalence is high among key populations. And for the epidemic overall, projections suggest that the epidemic is stagnating with what's currently being done. We need something additional. So one of the major concerns that clinicians, the community, government have about PrEP is whether PrEP, what effect does PrEP have on STIs and on condoms? So a systematic meta-analysis was published just earlier this year, and it looked at a total of over 4,000 participants. Looking at condom use, none of the studies found a significant increase in the proportion of men who have sex with men reporting condomless sex between baseline and follow-up. So no significant change on condom use. But it did suggest that where there was change, it was mostly concentrated amongst the people that were already at much higher risk. So they go from infrequent condom use to never using condoms. But some studies, like a trial of over 1,300 sex workers in India, found that there was no change in condom use and that adherence to PrEP was very high. Looking at STIs then, the meta-analysis did find that there was an increase in STIs between baseline and increase in any STIs between baseline and follow-up. But we also need to remember that this is in a context of a worldwide increase in STIs overall, and that studies and population-wide implementation, there hasn't been an explosion of STIs. So in places like Australia, where we've had almost over 17,000 people on PrEP, we haven't had the STI again. There has been no explosion. And many people taking PrEP do not ever get an STI. So we can expect that there might be an increase though, and the increased number of infections can relate to increased STI testing. We would expect that as people are testing more, we're going to find more infections. And more frequent STI testing and partner notification can lead to a reduced STI transmission. And modelling has shown that, which is really good. The better engagement we have, the lower the transmission. And there's no evidence, really critically, that to indicate that PrEP, the effectiveness of PrEP, is influenced at all by having an STI. So, what happens on a population scale when you implement PrEP? What are the opportunities for Indonesia? So EPIC New South Wales, which is the program I was part of before, started enrolment in March 2016, and it was a PrEP access program. It was designed as a public health intervention for people who are at high risk of HIV. It was a joint initiative by government, by clinicians and researchers in the community. Everybody was intimately involved in this. And initially it aimed to enroll 3,700 people, but quickly exceeded that and almost enrolled 10,000 people by the time the program closed and national rollout began earlier this year. Comparing the 12 months before EPIC New South Wales started enrollment to the 12 months after the first 3,700 people were enrolled, there was a 32% reduction in recent HIV infections. And although the reduction in although there was a reduction in in infections with no evidence of recent infection, what you'd expect from PrEP is that the effect should be the greatest in recent infections because it's preventing new infections.
2 minutes.
Okay. So it's a similar picture in central London, where since 2015 there's been an 80% reduction in diagnoses. And in San Francisco, who began rollout of PrEP in 2012, and since then has aggressively promoted it as part of testing and treatment, and there's been an enormous effect on the epidemic. So is PrEP more than just a pill? Yes, absolutely. We do not give PrEP and tell people to go away and come back when it's better. PrEP is a gateway for sexual health services for key populations. It's a package that includes regular HIV testing. It includes, prior to starting PrEP, things like creatinine, hepatitis B testing should also be offered. Because PrEP poses the drug resistance if a person has undetected HIV when starting or restarting PrEP, HIV testing is really important. And because PrEP is also only appropriate for people who are HIV negative. And just like with HIV treatment, support should be offered, including adherence counselling, particularly because, as I mentioned, PrEP efficacy is highly dependent on adherence. I'm just going to skip over this, but this is essentially how PrEP should be offered, and the example of the services that should be offered. One good point is that the side effects are pretty mild. PrEP is highly safe and effective. And the final thing that I probably just wanted to mention is that building demand is really critical among the community for scale-up and to achieve the population level benefits of PrEP. It's important for clinicians, for the community to raise awareness about PrEP among your colleagues and help counter misinformation, because one of the dangers is that people have the wrong information about PrEP. There is already demand there for PrEP. People are willing to take it, they want to take it, and they're starting to take it. It's being accessed online, people are going to Bangkok. So I think we need to start realizing that this is already there, even if it's not part of a national program. So PrEP is being rolled out across the globe. In Asia Pacific, this is from mid-2018, and it's already rapidly changing. There's already national rollouts starting in Thailand. In Vietnam, they've announced national rollout. There are trials beginning in Nepal, Cambodia, Malaysia, in addition to the trials that are already seen here. And there are additional proposals for phased rollout because we have the evidence. We don't need more trials. We know PrEP works. It's really about starting it and making sure it's working in your context. Indonesia has the opportunity to take a leading role in providing PrEP in such a populous and complex environment. So, final messages. PrEP is highly effective for preventing HIV when used as prescribed. Rapid scale-up can significantly reduce new infections. WHO recommends it. As part of a combination HIV response, testing, treating, preventing, we can all end HIV together. PrEP does not prevent against pregnancy or STIs, unfortunately, so we need to deliver it as part of a package. And the current epidemic in Indonesia is not increasing. PrEP could be the additional tool to help reduce infections among people who are at high risk.
Okay. Terima kasih, thank you, Dr.